Hello everybody, welcome back. My name is Carissa Conrad, Doctor of Physical Therapy and Therapeutic Pain Specialist, and I am the Vagus Nerve PT. Today what we're going to be doing is a series of exercises for chronic neck pain. This is video number 2. If you haven't already, please go back and watch video number 1 and work your way through those exercises first. So the first thing we're going to be doing is putting on our vagus nerve stimulation. If you remember from video number 1, the reasons why it's helpful to have the vagus nerve stimulation on while you're doing your exercises, particularly if you have chronic pain, is first of all, by activating the parasympathetic nervous system through the vagus nerve, we're going to have a decrease in that pain experience. Second of all, we will have an improvement in the activation of the multifidi muscles, which are those main stabilizers in the spine that we're going to be working today. Thirdly, vagus nerve stimulation enhances neuroplasticity. So the changes that we want to make in the brain are we're going to be better able to make those changes when our vagus nerve is stimulated. And finally, vagus nerve stimulation decreases systemic inflammation. So I'm clipping everything on here, and I'm going to turn on my unit. There we go. Okay, so first thing we're going to start with is that visualization sequence, just like we did last time. So I've got some images for you again today. So I'm going to bring this towards the camera here so you can see. Okay, so like we talked about last time in video number 1, these muscles that you see in this image are the muscles that are typically hypertonic. So upper trapezius, and then these muscles on the other side, they've taken the upper trapezius off, and you can see the ones underlying those. These are considered as a group the paraspinals. These are the muscles that are going to be hypertonic and activated by the nervous system when you're in that fight or flight state. And remember that if you have chronic pain, there's a chronic fight or flight state happening in that area of chronic pain. So what I want you to do is just take a moment to look at this image. And then when you're ready, you can either close your eyes or you can leave them open and continue looking at the image. And I just want you to get a sensation of through those muscles. Just allow a release. What you're doing here is giving your brain permission to let go of that chronic fight or flight state and allow those muscles to relax. You can spend a few moments here. If you feel like you need more time, feel free to pause the video. Just let those muscles release. When you're ready, we're going to move on to the multifidi muscle. So I got a better image this time. This is from Rehab My Patient. So here you can see those multifidi muscles. The multifidi are running all the way up and down the spine, as you can see in this image. This bony part in the center, that's called your spinous process. That's the part that you can feel. And then in between that spinous process and the transverse processes, which are those wings off the sides of the vertebrae, you'll have the multifidi filling in that space. Multifidi is the main stabilizing muscle in the spine. That's what we want to be working. And we know that when we've had pain, those muscles have become inhibited, they get weakened, and the nervous system shuts them down. And I think a big part of that has to do with that chronic fight or flight state. So with this image in mind, I want you to try imagining a green figure 8, like a grounding energy, running through those muscles. Since we're focusing on the neck today, I want you to specifically focus on your neck. So imagine those muscles in your neck and run a figure 8 of green grounding energy through those muscles. And again, you can close your eyes, you can continue to look at the image. You can pause the video if you feel like you need more time. Okay. Now I'm going to show you a couple of neurokinetic therapy corrections. So the idea with neurokinetic therapy is that when we have pain or injury, our body's going to change the pattern of muscle activation in order to keep us going. It's kind of like the compensation. Like people say, oh, I know I compensate. I move differently than I used to. So first one that we're going to do is for your latissimus dorsi muscle. Latissimus dorsi is a large muscle on your back, and that muscle is often inhibited when we have chronic neck pain. So what I want you to do, you're going to massage the area right behind your neck. So find the corner of your shoulder blade, the inner corner, and drop just off of that and just press gently. This does not need to be painful, just a gentle press. I'm going to do that together for a few seconds, 10 or 15 seconds here. Only press with the amount of pressure that feels comfortable to you. We're just off that corner of the shoulder blade there. Then, either sitting or you could stand against the wall or against a door, I want you to just press on that same side, press your hand very gently back into the wall, or I'm pressing mine into the edge of the table. You can't see it's out of the shot there, but pressing it into the edge of the treatment table. The pressure should be gentle again. This should not be painful at all. If it feels painful, you're pushing harder than you need to. And we're just going to press gently for a couple of seconds, relax. Again, a couple seconds, relax. A couple seconds, relax. Okay? Now we're going to go to the other side. Move my hair. So same thing, we're going to find the corner of the shoulder blade, top inner corner, that medial corner, and drop just off of that, massage that area. I'll turn all the way around so you can see what I'm doing in this area. And then we're going to do that press again. So with my right hand now, press back into the table, relax, back into the table, relax, back into the table, relax. Okay, good. We're going to do 2 more on each side. These next 2 are for the middle and lower trapezius. So we saw that trapezius in the picture that I showed you earlier. The one that was red, that's your trapezius muscle. It's a large muscle shaped like a big triangle on either side. So you're going to massage the upper portion of the trapezius. So that's that part right here that we always hold our tension in again, right? So we're going to massage that muscle. Again, this can be as gentle as you need it to be. You do not need to squeeze and cause any pain or discomfort. Okay. Now I'm going to bring that arm out to the side and just bring it back so that I can feel my shoulder blade coming towards my spine. So my scapula is moving toward my spine. And that's it. And we're going to come back one more time to that same upper trapezius muscle. Just rubbing that muscle gently. And now I'm going to bring my arm overhead, and I'm going to move again so that you can see my full body. Palm is facing front, back, 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 like I'm trying to bring my shoulder blade into my back pocket. Good. Now we're going to do the other side. Massaging that upper trapezius. My arm is out to the side, palm front, back, back, back. Bringing my shoulder blade toward my spine each time. Upper trapezius again. Palm is front, back, back, back. Okay. Now, if any of those feel painful or if you are unable to get into any of those positions, just skip that one. Do the ones that feel good for you and don't cause discomfort. This is just helping the body start to activate the muscles in the appropriate patterning for the exercises that we're going to do together. Okay, now that we've got our muscles turned on, gotten things calmed down in the nervous system, now we're in the most optimal place to start doing a little bit of strengthening. So if you remember in video 1, I introduced you to the concept of those multifidi muscles. I had you activate those muscles by pressing your tongue to the roof of your mouth. We did that together 10 times. We also practiced engaging at about half our maximum intensity, about 50%. That's what I would expect the multifidi to be engaged at, that level of intensity, with the exercises that we're going to do. So I want you to try that again. So go ahead and press your tongue to the roof of your mouth as hard as you can, and then cut that intensity about in half. That's what I want you to be able to hold while we're doing these exercises. What we're doing there is we're starting to strengthen those multifidi, we're improving the endurance of the multifidi, and what we're also going to be doing is having those multifidi contracting while we're moving the extremities. And that will both increase strength and endurance, as well as start to train the nervous system that this is what it should be doing all the time. So let's go ahead and get into position. We're going to be lying on our backs with our knees bent. Move your TENS unit with you here so that it doesn't get tangled up. Okay, the first exercise is called the dead bug. So what I want you to do is go ahead and press your tongue to the roof of your mouth at half of that maximum intensity again and hold it. While you're maintaining that contraction, go ahead and lift one arm at a time overhead. Now the goal here is to maintain that contraction with your multifidi and to get to 10 lifts on each arm. Now, as I mentioned in the previous video, what I want you to do is if you start to feel pain after 3, 4, 5, 7 reps, I want you to pause there. Typically what that means is that your multifidi are starting to fatigue. So I would rather you pause at that point than push through the pain. Because if you push through the pain, typically your body is switching back and using your old pattern for those, rather than activating the multifidi, it's relying on the paraspinals. Okay, I believe that was 10, but if I miscounted, I apologize. Okay, let's give our body a little rest. If it feels good to you, you can go back to that relaxation imagery. Go into your upper trap and paraspinals. Bring that green figure 8 back into those multifidi. Okay, and now we're going to move on to the second half of the exercise. I want you to go ahead and apply that pressure with your tongue at the 50% again. And while you're holding that, we're going to march. So you're going to lift one foot at a time. See if you can also kind of tuck your shoulder blades down and back a little bit, just so that you're not shrugging and compensating through your neck. And we're going to try for 10 times. Same rule applies here in terms of number of reps. 10 is the goal, but if you start to have symptoms sooner than rep 10, I want you to stop at that point and rest. You can try continuing, but typically that's about where your fatigue threshold is. And what you'll find is that the more often you do these exercises, you'll get stronger each time, and you'll be able to do more repetitions before you start to have pain. Okay, once again, I must get better at counting and talking, but we tried together. Okay, now, the next exercise is an isometric exercise. What we're going to be doing here is activating the longest colli muscle along with the cervical multifidi. So you won't be able to see what I'm doing very well, so I'm going to do my best to explain. So what you're going to do is apply that pressure again to the roof of your mouth with your tongue, and then bring your chin gently towards your chest. Now, what you'll notice is I'm not gripping, I'm not tightening down, and I'm not lifting my head at all. It's as though I have a juicy peach underneath my chin, and I'm just going to hold it there. I don't want to squish it, because I'm going to eat it later, and I don't want to let it drop either. So this co-contraction, we call this a co-contraction of the cervical multifidi and the longest colli muscle, is very effective at stabilizing through the cervical spine. And relax. So what we're going to try to do is hold for 7 seconds, and once again we're going for 10 repetitions. If you start to feel discomfort again at any point, go ahead and take a break, see if you can join back in, otherwise that's your stopping point for the day. So let's try. And release. And nod down, 2, 3, 4, 5, 6, 7, and release. And nod down, 2, 3, 4, 5, 6, 7, and release. And down, 2, 3, 4, 5, 6, 7, and release. And down, 2, 3, 4, 5, 6, 7, release. And down, 2, 3, 4, 5, 6, 7. 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 And here's our last one, number 10. Down, 2, 3, 4, 5, 6, 7. Good. Great job. Final exercise that we're going to do today is to activate that middle and lower trapezius muscle that we looked at the beginning and that we corrected for with the neurokinetic therapy correction. So for this exercise, what you're going to do is imagine your scapula, your shoulder blades, they're shaped like triangles, right? So I want you to think about the lower angle of the triangle, that we call that the inferior angle. I want you to tuck that into your back pockets. So again, this is very gentle. I'm just dropping my shoulders down and back. And release. So again, this should not be painful. Do it with an intensity, with a level of force that doesn't increase your pain. And we're going to start going through isometrics, holding for 7 seconds, and we're going to do 10 of them again. Same rule applies. If you get through 3 or 4 and you start to have pain, I want you to go ahead and stop there. You can try continuing after a little rest, but if it's still painful, then that's all for today, and you can come back to this tomorrow. So once again, we're going to be pressing the tongue to the roofs of our mouths, that 50% level, and then shoulder blades down and back. 2, 3, 4, 5, 6, 7, and relax. And 2, 2, 3, 4, 5, 6, 7. And 3, 2, 3, 4, 5, 6, 7. And 4, 2, 3, 4, 5, 6, 7. And 5, 2, 3, 4, 5, 6, 7. And 6, 2, 3, 4, 5, 6, 7, and 7, 2, 3, 4, 5, 6, 7, and 8, 2, 3, 4, 5, 6, 7, 9, 2, 3, 4, 5, 6, 7, and 10, 2, 3, 4, 5, 6, 7. Excellent. That completes our strengthening portion. Let's just finish with a nice stretch. This stretch usually feels really good for just kind of resetting our posture. I call this the blooming flower stretch. I can't remember if that was what it was originally called. What you're going to do, turn your palms facing one another, fingers facing one another, and now I'm going to cross over, up, overhead, and bring my arms down. Just like that. And then I'm going to do one more. Palms facing each other, fingers facing each other, and I'm going to switch which arm was in front, up, overhead, and down. That stretch is a nice one. It gathers the nervous tissue, the fascial tissue, and moves everything down and back. Our nice upright posture relieves the tension through the neck. Thank you so much for joining me today for this video. Let me know what you thought. Let me know what other types of videos you'd like to see. I'm really excited to continue showing you content like this and encouraging your vagus nerve stimulation to help assist in your recovery. So thank you for watching. I am Carissa Conrad, and we will see you on the next one.